Great, thank you. Well, good afternoon, everyone, and welcome to Trust for America's Health's AIDS-Friendly Public Health Systems June training. We're happy you're here to join us today to learn more about how the public health sector can support older adult health and well-being. My name is Megan Wolf, and I'm joined today by my colleague, Dr. Karan Phillips. And the AFPHS movement would not be possible without the generous support from and partnership with the June AFPHS Foundation. So thank you to our partners there. Next slide, please. We'll go through just a couple of housekeeping items if you'll bear with me. So we ask that you do keep your devices muted during the presentation so we can avoid any background noise or other interruptions. But please feel free to add any questions you have into the chat throughout the presentation, and we'll definitely have some time at the end for some discussion. And next slide. All of our AFPHS trainings are recorded, and the slide deck is also shared with anyone who registered for the training afterward within just a couple days. So if you are using an AI note-taking tool, please let us know by commenting in the chat before our speakers begin. And in addition, you must be present in the training with the AI note-taking tool. Notes generated from any AI tool can only be used for personal use. Next slide. Your feedback is also very important to us, so we ask that each participant just stop and take a couple moments to complete an anonymous feedback survey that will appear on your screen at the end of the training. Your insights really help us to improve our trainings and to give us more information, and will help our evaluation partner, the New York Academy of Medicine, as well, as they're doing the evaluation of our work. Next slide. So as most of you know, but for those of you who don't, Trust for America's Health, or TFAH as we're commonly known, is a public health policy research and advocacy organization dedicated to optimal health for every person and community. TFAH produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness, and Pain in the Nation, which you're going to hear about today. Related to our healthy aging work, we have produced several reports on many topics, including housing for older adults, rural healthy aging, and the one you see on the screen here is on aligning the 10 essential public health services with our AFPHS 6Cs framework. So we invite you to go to TFAH.org for our TFAH reports and to AFPHS.org for our healthy aging reports. And next slide. So while this training is going to focus on our 2025 Pain in the Nation report, I wanted to take a moment to just connect back to our theme for this year, which is the age-friendly ecosystem. And we define the age-friendly ecosystem as a multi-sectoral network of practitioners, providers, and organizations that prioritize improved quality of life for older adults, their families, caregivers, and communities through collaborative impact. As we age, many of us will experience some challenges, even multiple chronic conditions, including some mental and behavioral health issues. So with the understanding that none of us, no one sector can solve these issues alone, it's important for us to identify which of our sectoral partners, whether it's public health, social care, health systems, academia, workplaces, or in the community, which of those partners can effectively join us to both identify common goals and prioritize them, and then work towards solutions. So this slide highlights just some of the issues related to mental health among older adults that they may experience, such as that 80% of older adults suffer at least one chronic health condition, putting them at higher risk for depression. And that with regard to ageism, ageism affects so many people, so many of us, and can negatively impact our mental health as well. And then social isolation and loneliness, especially following the pandemic, has been very common among older adults and can again increase the risk of mental health, mental illness, increased cognitive decline, and even lead to premature death. So mental issues are important, and we're going to hear about some of them today and how they impact older adults, but then also have an opportunity to talk about solutions. And one of the key takeaways, of course, for us and thinking about how this relates to the ecosystem is that it takes collaboration across sectors to really address some of these issues effectively. Okay, so next slide, and we'll turn now to our colleagues that Karan and I have at TFAH, two members of our team, one from our government relations team and another from our communications and policy research team. So happy to introduce Molly Warren, who is a senior health policy researcher and analyst, and Lauren Battle, who is a government relations manager. So we'll start with you, Molly. Thank you so much for joining us today.
Good afternoon, everyone. Thanks, Megan. And thank you all for having me. For today's training, I'm going to share key findings from this year's Pain in the Nation report and cover the impact on older adults. And then Lauren will discuss our recommendations. Next slide, please. To start, I'm going to just step back for a bit of background on this report series. The first Pain in the Nation report was issued by TFAH in 2017, and it has since become an annual report that includes the latest data on alcohol, drug, and suicide deaths. And it also always has a set of recommendations. And in the last few years, we've added a feature section highlighting a particular timely issue. So recent features have highlighted the drug overdose crisis, youth mental health and well-being, and COVID-19. Next slide, please. This year's feature topic looks at recent progress on drug overdose deaths. So after decades of increases, there has been a decrease in mortality recently. In 2020 and 2021, there were double-digit increases in mortality from drug overdoses. In 2022, there was a flat trend. And in 2023, there was a decline of 4%. And then provisional data for 2024 suggests a very large decline, an estimated 27% decrease in the number of deaths, which is really great news after so many years of increases. Unfortunately, when we look at 2023 data, which is the last year with final and complete data, we see that improved rates were not universal across groups. Next slide, please. So, for example, when we look by racial and ethnic group, we see that only white people had statistically significant decreases in mortality. American Indian, Alaska Native, Asian, and Hispanic Latino people had non-significant changes, and Black and Native Hawaiian and other Pacific Islander people had statistically significant increases. And you can see this on the slide of the last 5 years. It is important to note that when groups may not have seen a better rate from 2020 to 2023, most of them had a better trend. So they moved from a flat or a smaller, they moved from having a big increase to a flat or a smaller increase. Some other groups where we saw some differences by region. So the Northeast, Midwest, and South all had decreases in drug overdose rates, while the West had a pretty big increase. We also saw differences by drug type. So heroin and synthetic opioids had decreases, but cocaine and other psychostimulants like methamphetamines had increases. And we also saw some differences by age groups. Younger age groups had decreases in drug overdose deaths, while the age groups 55 to 74 and 75 and older had an increased or flat rate from 2020 to 2023. The report has a breakdown of all these groups and more if you want to look at some of the recent patterns yourself. Next slide, please. In addition to looking at the data for the progress in drug overdose deaths, we also describe some of the policy and program successes that we have seen. There is no singular reason for improvements in drug overdoses, but we think it is rooted in a number of important long-term strategies, policies, and programs. So this includes things like sustained investment in public health and community overdose response, which is often supported by federal grants, data systems, and technical assistance. We also see harm reduction strategies, including naloxone and drug checking equipment. And then there's also multi-sector partnerships that we found to be very important to some of this progress. The feature concludes by looking forward on how to sustain and build on this progress. We are particularly concerned right now that this progress is at risk considering the recent federal funding and workforce cuts. A few of our priorities for building on the work is investing in public health and behavioral health overdose response, continuing to improve data surveillance to allow for real-time response, maximizing harm reduction strategies, and focusing on underlying drivers of substance misuse. Next slide, please. In our most recent report, we also looked at the most recent mortality data across the three causes this report looks at. So we saw that there was a decline in the combined mortality rate for alcohol, drug, and suicide. That was a decrease of 4% in 2023. It is the first substantial decrease in this combined figure that we've seen since we started this report in 2017. And this was driven by a decrease in alcohol-induced deaths by 7%. This is the second year there's been a decline in alcohol-induced deaths. And as I mentioned previously, there's a decrease in drug overdoses of 4%. And then we see that suicide has been at the same peak level for several years. Next slide, please. Even with these recent improvements, the long-term trends are still quite bad. So over the last 2 decades, we went from a majority of states being in green in 2003. So that's the map on the left. So most of those states were 30 deaths per 100,000 or under. And then the middle graph shows 2013. And so it has a majority of the states in yellow, which is 30 to 50 deaths per 100,000. And then the graph on the right is the most recent data from 2023. And that has the states mostly in the 2 orange categories, which is 50 to 90 deaths per 100,000. And then we even saw some states that had more than 100 deaths per 100,000. Most of this increase has been driven by drug overdoses, but alcohol and suicide mortality have also increased over those 2 decades. Next slide. So for this audience, I also pulled out some additional mortality data by age group. You can see in these graphs that mortality rates and patterns vary quite a bit by age group. So for alcohol-induced deaths, which is the left graph, adults age 55 to 74 have the highest mortality rates, followed by 35 to 54, and then ages 75 and older. Younger adults and youth have comparatively very low mortality for this cause. For drug overdose deaths, which is the middle graph, the highest mortality is among adults age 35 to 54, followed by adults age 55 to 74 and 18 to 34. Older adults and youth have comparatively low mortality for this cause. And then the last graph on the right is suicide deaths. So for this, you can see youth have comparatively low mortality for this cause, with all of the adult age groups fairly close together, though older adults have the highest mortality rates in the last few years. And then that's followed by adults 35 to 54. Next slide. I wanted to also focus on suicide among older adults for a few minutes. Almost 5,000 adults age 75 and older died by suicide in 2023, and that's the highest rate of any age group in the United States. If you look at the demographics of who is dying by suicide among older adults, we see that men are much more likely to die by suicide, as are white people and those living in the West and South regions of the country. So that you can look at the demographics on the left side of the graph. And And then if you look at suicide method, more than 3/4 of older adults who die by suicide use firearm. Firearm are much more lethal method of suicide than any of the other common methods. And this is a much higher proportion than the general population. So for the whole population, about half of all suicides are by firearm. And this is potentially one of the reasons for a higher suicide rate among this age group. Next slide. Suicide among older adults has been specifically among older adults has been studied a lot, and research points to some key risk and protective factors. This includes risk factors like stressful life events, and particularly the death of a spouse is a critical, vulnerable moment for many older adults. There's also depression, access to lethal means of suicide, which is like firearms, social isolation and loneliness, physical illness or functional impairment, and dementia. There are also important protective factors to consider as well. So protective factors like family and other support systems, social interactions and belonging, positive aging and quality of life, and coping and adaptive behaviors. I think these risk and protective factors are important when considering suicide prevention specifically, as well as more general policy programs and interventions for older adults. Next slide. Finally, I want to highlight one additional resource in this report. The appendices have a lot of additional data, including data by age group when it's available, including additional mortality data, as well as substance use and mental health data. And with that, next slide, I'll just pass it on to Lauren, who's going to talk about our recommendations. Thanks, everyone.
Thanks, Molly. Hi, everyone. Lauren Battle, and I'm going to talk through our policy recommendations within the report. So when we think about the policy recommendations in this year's Pain in the Nation report, they essentially fit within three key buckets. The first is protecting investments within prevention and conditions that ultimately promote health. Second, we also focus on reducing overdose risk and access to lethal means of suicide, and then also transforming the mental health and substance use prevention system. But overall, thinking about policies and programs that will really aim to progress these three key areas. We can go ahead to the next slide. So in thinking about protecting investments in prevention and conditions that promote health, this is largely in response to recent proposals to eliminate and consolidate a lot of key programs across the Department of Health and Human Services. We can go ahead to the next slide. And also a lot of clawbacks that have already impacted different states and localities. So before I hit some of those key recommendations, I do want to highlight some of the key pieces from the FY26 President's proposed budget that would specifically impact older adults as it relates to behavioral health. The first that I want to highlight is that the proposed budget would eliminate the Older Adult Falls Prevention Program from the CDC Injury Center, which has been previously funded at $3 million for FY24, and we're currently utilizing a continuing resolution, so it's at the same funding level for FY25. So that's definitely a cause for concern given the great work that this program does and the work that this program does to support states and localities in preventing elder falls within different communities. Additionally, I do want to highlight that the National Strategy for Suicide Prevention within the Department of Health and Human Services has been slated to move to a new administration for a Healthy America, which is essentially a consolidation of several agencies and offices across the Department of Health and Human Services. And that is proposed to shift to this new administration and retain its $28.2 million funding level for FY26. NSSP focuses on all adults in regards to suicide prevention, but it does have a key focus on older adults as well as adults in rural areas and American Indian, Alaska Native adults. So just wanted to highlight these key pieces. Of course, one of somewhat more concern than the other, but just want to make everyone aware of some of the key proposals in the behavioral health space that are specifically targeted towards older adults. And then when we also think about policy recommendations in response to what we're seeing across the government right now, we really want to overall protect investments in injury violence prevention. Again, thinking about suicide prevention, thinking about the work that the CDC Injury Center does. The CDC Injury Center does a lot of work surrounding adverse childhood experiences prevention. And I do want to just mention that although ACEs is definitely work that is catered to young people and people under 18 to 21 years old, but I do want to highlight that given the fact that average childhood experiences can have strong impacts across the life course. When we look at chronic disease that impacts people into all ages, a lot of that can be traced back to traumatic experiences that individuals experienced while they were young. So when we think about adverse childhood experiences, yes, this work would benefit young people, but it has the opportunity to benefit people across all ages. So definitely want to highlight that work as well. And also thinking about a lot of the work that CDC does surrounding weather-related events and environmental disasters as well. So we have some key recommendations targeted towards those policy areas and a lot of the efforts that we're seeing to roll back on that. And then we can go ahead to the next slide, please. And so our next bucket, thinking about reducing overdose risk and access to lethal means of suicide, we have some key points that I've laid out here, and the report has more broader recommendations in regards to specific bills and other legislative actions and administrative actions that we'd recommend there. But I'll hit out a couple of these specifically. We mentioned thinking about pain management and ensuring that healthcare professionals are utilizing responsible prescribing practices. We also want to think about reducing access to lethal means of suicide and lethal means of overdose, and making sure that those items are not accessible to individuals within their communities. We also want to think about harm reduction efforts and access to Narcan and other opioid overdose reversal medications that have had such a large impact on the reduction in overdose rates that we've seen recently. So wanting to ensure that these interventions that have contributed to the figures that we've been seeing in recent years and months, want to ensure that we're maintaining those and that communities have access to continue to bolster these efforts within their communities. We can go to the next slide, please. And then in terms of our third bucket, thinking about transforming the mental health and substance use prevention system, again, have some more specific recommendations within the report that highlight key areas of legislation and funding that are of interest. But I'll kind of highlight a few of these key areas here. And thinking about workforce, really wanting to ensure that we have a robust behavioral health workforce that is not just seated on the treatment end, but also working on the prevention side and also working on the recovery side. You know, as we're thinking about as it pertains to older adults, a lot of individuals within that range are in the recovery space. So wanting to ensure that we have a robust workforce that is tailored to the specific needs within the population of individuals who are recovering from behavioral health challenges. And I do want to flag in terms of responding to key areas of movement at the federal government and key proposals, a lot of the workforce-related programs within the behavioral health space have been slated for elimination or consolidation, such as the Minority Fellowship Program at SAMHSA. So just want to underscore a lot of the movement that's currently happening as it relates to the behavioral health workforce. We also want to think about data collection and those efforts, which CDC does a lot of great work there, and ensuring that we have the data and surveillance to target these programs and target populations. I know Molly had mentioned at the beginning that we have some specific data as it relates to older adults in suicide, and the surveillance work that CDC has been able to do is aided to our ability to have that data and then underscore interventions that are targeted towards that. But we need to ensure that we're maintaining those efforts and maintaining state level ability to continue those efforts as well. And then also we touch on the continuum crisis intervention programs. That means things like the 988 Suicide and Crisis Lifeline, where we've also seen proposed cuts to that as well, and ensuring that states and localities have the funds that they need to continue to bolster the lifeline to ensure that when individuals within their community give the lifeline a call, that there's someone on the end who can provide them with the services that they need. So those are just some of the key spaces that we think about when we're really aiming to transform the overall mental health and substance use prevention space. We can go ahead to the last slide there. And so overall, just to kind of summarize everything, really thinking about maintaining our current system and then building on what's currently working. We've definitely made some progress in these figures and in these rates, particularly as it relates to overdose, but we don't want to curtail those efforts. We don't want to pull back on what we know has been working within states and communities. We want to maintain those investments. And so when we're thinking about restructuring of HHS, not cutting key programs or eliminating what's working, not cutting public health funding or laying off individuals who are really the brains behind a lot of these incredible interventions, because that does put us at risk of kind of going backwards with the progress that we've made. And so as we're continuing to engage with policymakers at the federal level, we're underscoring the importance of these key programs and really ensuring that they have an understanding as to how it's impacted their states and communities, how it's impacting their constituents, to ensure that we maintain this incredible work. So that's essentially where we land with our recommendations for 2025. Like we said in the report, we definitely lay out a lot of the key pieces of legislation. So always happy to answer any questions on that folks have as they're perusing. But I'll stop there, and that wraps up the policy recommendations. Thanks so much.
Thank you, Lauren, and thank you, Molly. So if you have questions specifically related to the Pain in the Nation report, please put them in the chat, or Karan, I think we can take the slides down, and so so if you have questions and you want to just come up, open your video and unmute. We're happy to entertain those questions. But I just also want to let you all know that we have two really wonderful experts with us today on the government relations and the administration's budget, and on data around these issues. So this is a great opportunity to engage with our two TFAH partners here if you would like to do so. So I know there was already a question about CDC's STEADY program, which is the fall prevention program. And I just went quickly online and checked. And so those resources are still there right now because, right, Lauren, because we're still under FY25 funding.
Yes, that's correct. So when I was speaking in regards to the president's budget, as of right now, that is a proposal. So none of that is enacted. We're still functioning off of the continuing resolution for FY25. But of course, Congress is now currently looking towards FY26 and utilizing the president's budget as somewhat of a blueprint for creating that. So none of that is currently enacted, but definitely worth paying attention to.
Great. Thank you, Lauren. Appreciate that explanation. So questions, Jane, welcome.
Megan, this of course, these are always so great, and I know we talk about them all the time. I wanted to respond to Donna Lissy about her being a pharmacist. We support the ASCP work on pharmacists as age-friendly champions, and I guess I didn't quite understand what she was asking, and if there's something that I can take back to the ASCP team, I will. If Donna could.
Yes. Oh, yes. Hi, Jane. Oh, hi. What I was basically saying is the ASCP in the past and periodically has a full certificate program, which it's an interdisciplinary program between a pharmacy discipline, occupational therapy, and physical therapy. It's an excellent program. I went through it. It's a 2-day program where they show you how the interdisciplinary team works. Goes through all the FRIDs, which are full risk-inducing medications or drugs. And so, that's also ties into the STEADY program as well. So my concern was any cuts to that would jeopardize this type of interdisciplinary, intercollaboratory work that is currently going on. So yeah, that was my concern.
Well, thank you so much for bringing that up. And have you had a chance to look at their pharmacy as champion, age-friendly champion work or?
Oh, yes.
training?
Yes.
Okay.
Yeah, absolutely. In fact, I was just on a call with Chad this morning and doing some work in that area as well. So timely,
Great.
I'm in New Jersey, so we're kind of looking at some things on a local level. So
You're
absolutely.
way ahead of us. Yeah.
Dr. Kathy Rowe too in New Jersey. So
Beautiful.
so
Oh, she's great.
Yes.
Yep.
But we know her, don't we, Megan? Yeah. Well,
Sure
thank you
do.
so much, Donna. Thanks for that.
Sure.
that
Thank you.
information.
Thank you.
Yeah. So I would recommend that for those of you who are interested in programs like the STEADY program, to download those resources while they're still available. And you know, and the same with many of the other programs that are slated to be restructured or eliminated. You know, we just don't know how long those resources will be available. So my advice would be go ahead and download now what is available. Other questions that folks may have? I usually have some questions in my
Okay,
back
thanks.
pocket. Yeah,
And-
I feel
Thank
like you guys were very thorough. Jane, go
Yeah,
ahead.
I don't want to, yeah. And Megan, I probably missed this because I had a little trouble, you know, switching from one thing to the next. But how often do you do this report? One of the reasons that the foundation partnered with TFAH is because of these amazing reports that they do. And they have a certain set ones that come out every year, Megan. Is this an every 2-year or 3-year?
Molly, you want to handle that one?
Yeah, so it is now an annual report.
Okay.
Yeah, we started in 2017 and it was a very comprehensive report, like over 200 pages. And then we did a few shorter ones, like briefs for a couple of years. And now for the last 5 or 6 years, we've done annual reports that we've chatted where we have the feature section so we can really dive into an important, timely topic.
Right. And so our Pain in the Nation, Ready or Not, State of Obesity, and our funding report are the 4 big annual reports that we do. Donna, you had another question.
Yes. No, I just want to compliment this presentation. This was excellent. One of the things, I'm in New Jersey and I'm in Somerset County, New Jersey. And one of the things that we recently started was a program called SAGE, which is Substance Awareness and Guidance for Elders. And this was brought by the fact that what was said in this report is that we're seeing a decline in other age groups, but the 55 plus age group is a group that we're seeing an increase. And another thing that we have very active, and I sit on that too, is the overdose fatality review. And so what we are seeing is that overdoses, especially mixed overdoses with stimulants, it's that 4th wave that we're seeing of the opiate epidemic or crisis, where we're starting to see the fentanyl and the stimulants even in the older adult population. And that is particularly scary given all the underlying comorbidities, cardiovascular disease that this group has, that even if it's not a fatal overdose from an opioid, the amphetamine part or the stimulant part can definitely have a fatal consequence as well. So thank you for doing this. It's very helpful. It's very helpful in the work I do.
Thank you, Donna. I appreciate that.
Yeah, thank you. And I'll add, we are the data that we hadn't, where we only have 2023 data to really understand the trends by group. And so there was a lot of improvement in 2024, but we don't know how that was affected different groups. And so I am hopeful that more groups saw improvement in 2024, but we are certainly concerned that the 2023 data did not show all groups improving.
Right. And I think the discussion on this report and the data that is available is that, yes, we're making progress, but there's still great cause for concern. I mean, if you recall the maps that were on one of Molly's slides, where the progression toward the higher rates of death attributable to alcohol, drug, and suicide is still appalling. It's still, you know, not where we need to be. And I really appreciate the discussion about the risk and protective factors. And I think that, you know, social isolation and loneliness are such a huge issue among older adults. Unfortunately, you know, catalyzed by the pandemic. But there have been a number of reports and convenings and so forth held on social isolation and loneliness. So I'm going to drop a link in here to a report that reported on a convening that Jane, that the foundation held last year with the New York Academy of Medicine. There are some really, really helpful and valuable recommendations in that report to address social isolation and loneliness, to increase engagement in your communities among older people. And I think this is really one of the primary protective factors that we can see is increasing engagement. So I just wanted to put that out there as another resource for you all, and see if others are aware of other resources or protective factors that you can share with the group with regard to these issues. And Donna, there is a question for you. So if you would share your contact information, Rana works for SAFE, a national nonprofit that stands for Stop the Addiction Fatality Epidemic. And she would like to chat with you further about what you just shared. So if you all want to communicate privately, that would be great.
Thank you.
All right, any other questions while we still have our experts here with us? All right, a short but impactful training time today. So thank you all for being with us today. Lauren and Molly, thank you so much for sharing your expertise. Please know that you all can always reach out to us if you have ideas for us or if you have questions. We will definitely follow up. So our contact information will be near the end. Karan, you want to go ahead and bring up the PowerPoint again? We have some information for you all if you'll stick with us for just a couple more minutes.
Yes, thank you, Megan. Thank you, Lauren. Thank you, Molly, so much for the presentation. Just to close us out, our next training will be on July 17th, and we are going to be talking about a new tool, our 6 C's Training and Implementation Guide. So we have a little something more special. We're going to have a little bit more extended time. Some of our partners will be presenting with us, so we're looking forward to our next training. And again, it will be a little slightly longer training coming up next month, and you can register for that on our website. And if you are pursuing the champion designation, please indicate that you have attended this training by navigating to the website on the screen or using the QR code to indicate your attendance here today. And I will pause for a few more seconds. Thank you all for your time.
All right, thanks everyone. We look forward to seeing you next month. Stay safe and stay cool in the summer weather.